Hi, I'm Dr. Sebastian Gonzalez from the Performance Place, and today is the last video of our 5-part series on how to manage grade 1 and minor grade 2 muscle tears, or as most athletes and people call them, is muscle strains. I think it's a very great series so far. If you're starting here, please go back and don't even start here. 1, 2, 3, 4 obviously are very important because they lead into this. I'll summarize a couple things here in the beginning, but for the most part you have to watch them in their entirety, and you have to be able to read the research that I presented in the text around the video as well. So I hope this helps you guys out. Let's just get started. Now, if you're going to subscribe to our other videos, there should be some links on the side here which you can click on. Those it'll take you to our subscriber feed, and you'll get videos 1 through 5, including this one. Now, to recap the other ones, basically there's about 5 to 7 days after the point of an injury where typically people think about resting a lot, and they rest well and beyond what they should oftentimes. Unless there's special circumstances, a lot of times they shouldn't rest, usually beyond, or complete rest beyond about 5 to 7 days. This is a great time to use your price method types of stuff, your rest, ice, heat, compression, elevate, and so on. Usually after that, about 7 to 21 days, you're looking at more of you should be able to stretch the tissue out, but not excessively. Now, if I was to injure my wrist and there was say a muscle injury on this side, I wouldn't really grab it and yank on it like this. You might separate some of the fibers and damage the healing or slow the healing process. But what I would probably do is I would start making letters with my hand, possibly. And what this does is basically uses the other muscles to stretch it to a normal point. So, don't overstretch them. Reciprocal inhibition, passive modalities, and light tissue work are all great things within this time frame. Last time we went over about 6 to 10 weeks, which is when you start to resume normal strength and conditioning. There's obviously going to be some additions of small, isolated, therapy-based exercise in the middle, such as rotator cuff exercise if you have a shoulder injury. But you might start pulling, you might start pushing, you might start doing a lot of other things, normal-looking strength and conditioning. Now, typically when someone starts to rehab or start to really load a muscle or tendon that's been injured, there's a ton of hesitation, and I don't blame them. It's actually very common to get flare-ups along the way with rehab, and I tell people in the very beginning, don't expect this to be easy, don't expect it to go smoothly, because it won't. You know, there's a lot of psychology in sports rehab, and I talked about this at the end of the last video, and I'm going to hammer on it more today, is that you really have to understand the education. You have to be educated about what your injury is, what typically works, and what are your best odds of improving. And if I were to estimate the amount of people, or especially weekend warriors, that really don't have, they have no problems with stopping their sport, like they might drop out of like softball or something like that, and they have no problem with it, like they didn't want to play at all anyways. I would say the amount of people that drop out of rehab because they have fear or hesitation, I would say is easily about 50%. Patient compliance in rehab facilities like this, it's usually very low to the middle. And usually you'll get someone who's very dedicated, who has a goal in mind. They might be running the Boston Marathon. They're very dedicated up until that point, and then they start to slow again. So set your goals early and understand what works. To really hit home on this subject of being afraid, I actually pulled up an article which was from 2009, which was done on patients who had a minor back surgery. It was called a single-level microdiscectomy, and usually fear will lead to avoidance and lack of rehab. But in this case, they basically had two groups. One group did exercise without being educated about what the exercises were for. The other group did exercises with education to understand and basically educate them to follow the plan of attack. This group, actually, when they measured disability at the end of the study, this group, which had education as well as exercise, the same exercises, actually did much better than this group. And that just shows the education or empowering the patient is very important. That's why I'm trying to empower you guys right now. Now, during this late strength period, it's about 10 weeks to about a year. Arguably, we can go even longer than that. But again, we've already gone towards normal strength and conditioning. Now you just basically start increasing the load slowly, and also you can increase speeds depending upon what your injury is. So that's going to include your isometric contractions, your eccentric contractions, your concentric contractions. And if you don't know these terms, you can go back to the other video. But really, this point too is an important time to incorporate more deep tissue work, such as your active release, Graston, your foam rolling, and so on. Because usually, as you start to increase the load on the muscle, at some point there's going to be a flare-up. And usually, to minimize the potential of a flare-up, you have to make it so the tissue's in good health, which is the whole point of deep tissue work in the first place. Now, people in this late strength phase, you'd probably see them doing, like if you were at the gym and you saw them doing a workout, they would probably look like they're doing a normal workout, yet they might take more breaks. They might decrease the weight. If you're an athlete, like to say a soccer player, they might not be playing fully yet, but they're probably out there doing cone drills and so on, lateral movement drills, and they're kind of testing the water. They're making it so their body is starting to become re-educated about the movements before they start loading them or doing them even quicker. So again, it should look very normal at this point, and it won't even look that bad in regards to disability, but you can start getting to this point if you've developed the right plan of attack in the beginning for your minor strain. Now, after hearing me say all this stuff and kind of tell you the way it should go, you're probably thinking in your head, and I know a lot of people probably will think this, is that you probably think you're nowhere close to the timeline that I've talked about. And again, this is all in theory, and there's hiccups everywhere, and everyone has their own unique case and so on. But there's also a couple different factors you should take into consideration if you're nowhere close to what I've already talked about. And I'll lay out 3 things. The first is, do you have your diagnosis correct in the first place? Now, this video series is on minor strains up to about grade 2 of muscle and tendon. Ligaments heal very differently. Cartilage heals very differently. And by cartilage, I mean a meniscus injury of a knee, or a slap tear of a shoulder, or a labrum tear of the hip. All these really push time frames back, and typically when I see people misdiagnosed with basically they haven't identified a cartilage issue, they're cases that are fairly unresponsive, and they act very differently and don't basically have a linear progression of improvement as these soft tissue injuries do. So if you are not progressing in the right direction, or you're basically not following these timelines, perhaps you should confirm your diagnosis. And an image such as an MRI or a musculoskeletal ultrasound would be probably good enough for me in my office to confirm or make an opinion based upon a case like that. Second thing to consider is, did you take excessive rest? If you've been resting for, let's just go crazy, let's say 2 years, and you expect your injury to respond the same way, the reason the first 6 months is so critical, and the reason I'm making this video, is because there's a lot going on in that time frame. There's a lot of blood being pushed to the area, there's a lot of healing going on, and afterwards you get these chronic injuries, which is basically like tendinosis rather than itis, and they don't respond the same. So excessive rest will really push these time frames around, and it could be a reason why you might not be responding the same way as someone who maybe took care of it a different way in the beginning. The third thing is, and I like to play devil's advocate because sometimes you have to make people think, is that if you've been treated for this and it's the right diagnosis, perhaps your provider's not doing as good a job as they need to. And I'm not saying anyone's doing basically a bad job or naming names, but there's definitely different scales of skills in different degrees and so on. And I think in any profession you might have a great plumber and a terrible plumber, and they might have the same licensing or credentialing. When it comes to physical therapy or chiropractic or MDs, you get the same thing. They have the same degrees, they pass the same tests, but they might not have the same competency. And there's a reason why there's experts and specialists out there, is because they have very good understanding of a certain type of thing. So in this situation, typically I just basically recommend a second and third opinion. If you have imaging, take it to someone else that you might trust. Take it to another person. If everyone agrees on the same thing, perhaps you should look at the treatment plan. Is the treatment plan good enough? So if things are put in place and done correctly, they should basically follow a certain type of healing process like I've laid out here. If things are not correct, or you're getting excessive flare-ups, or you have the wrong diagnosis, or you took excessive rest, then they could skew these timelines just a little bit. Now back to the actual late strength period topic. You're probably wondering if I'm going to give out some type of killer program which is going to solve all your problems, and sadly I'm not going to, because there's there's an aspect of every injury that's different in each person, regardless of if the condition is the same or not. And every treatment program or rehab program should be tailored to that specific injury, as well as the person's capabilities, age, and so on. So anything that you might take off of YouTube or the internet, which is a standard type of plan, they're probably not horrible, but realistically, you can find someone who can design a program specific to your condition and probably do it in less than an hour. And it's going to decrease the chance of risk and probably get you far and beyond much faster than a standard program. And if you guys really want someone like me to do it, I can actually do them. We do offer phone calls for a small fee, and you can just find our information on our website. There's probably one at the bottom of this video, or our website is p2sportscare.com. You'll get me on the phone directly, and we'll just basically talk a lot of theory about your condition and kind of calm you and set you off in the right direction. Again, there's a standard that we have in medical that you can't treat or give specific actions to somebody you haven't seen before or diagnose. Because the fact of the matter is, if you had a strain and ended up being cancer and you died, then I'm responsible and everybody else would be in the medical profession as well. So it's against the law to do that. However, if you had a shoulder condition and you called to talk to me about theory about shoulder conditions, I have no problem with doing that. Education on any grounds is perfectly fine, but as soon as you ask a specific question about how to deal with something in your case, then we can't answer, and this goes across the board for everybody. But again, if you guys want my help, I can definitely supply something. So we'll recap. About 6 to 10 weeks, you should start increasing the amount of strength and conditioning and increasing the load and changing the speed. Second, you should be able to incorporate deep tissue work such as active release, Graston, deep manual therapies, deep tissue massage, foam rolling, whatever you want to call it, usually about 1 to 2 times a week, and it should be focused on the spot. This will decrease the chance of scar tissue formation and decrease the chance of re-injury. And third, know what works. Okay? I know there's going to be hesitation and there's going to be fear, but if you educate yourself, there's going to be much lower chance of you failing. Okay? So find out how the joint works. Find out what are the surfaces in the joint, what are the cartilages, the tendons, the ligaments, and so on. The more you educate yourself, the less you're going to have hesitation even for a good plan of attack that's been put in front of you. So I can't stress this enough, and there's actually no excuse for someone going online and looking up, Googling or YouTubing joint mechanics of the shoulder. Even if you look at like 3-4 different references and one of them's wrong, you're going to be able to shift through and figure out which ones are basically the right answers. So there's no excuse for not educating yourself. It's basically just, I'm going to call it out. If you can't spend 5 minutes on watching a video and educating yourself, you're kind of lazy. So sorry to say it. So if you guys want more help, let me know, and I'm very glad this video series is finally over because it's been a time crunch for me. I'll do more videos on different things. If you have suggestions of what you want to hear about or topics, I would love to do more. I love doing videos. So link up with us on the sides. There is areas for our email campaign, which have podcasts, articles, different videos that haven't been put up on YouTube or anything like that. So there's good information on those as well. So link up to us, link up to the Performance Place, and I don't think you'll be disappointed. We try to put out only the best information and research-based stuff that can be proven, stuff that's used across the board by good sports chiros, good physical therapists, and good doctors in general. So take care, and I hope this all helps you.